Welcome back to CHIRO Coffee Chat. I'm Dr. Pete.
I'm Dr. Carla.
So on our last video, we talked about disc problems. And on this video, we're going to show some of the approaches we use in the office to help people suffering with disc problems. Now, you're hearing disc problems. What might that mean? It might mean low back pain. It might mean pain going down the leg, sciatica. So one of the first things that we know about discs is spinal flexion, which is bending forward, tends to make them worse. So Dr. Carla, let's demonstrate the spinal extension. You guys might be familiar with this posture from yoga as like the cobra pose. So basically what it would involve is, Dr. Carla, lifting yourself up. You can rest on your forearms. Yep. You can push yourself up, or you can even rest on the forearms. And what that is doing is putting the low back into a position called extension. So that would relieve some of the pressure that is pushing the disc material into the back and irritating nerves. So a person with a disc problem might find this posture to be relieving in terms of low back and leg symptoms, and it's something that's probably safe for you to try at home. Okay, so we're pretending here that Dr. Carla is suffering with disc herniation and sciatica. When these people come in the office, we got to be really gentle with them. We can't be moving them forcefully. A lot of times, when we're starting to work with them, it's very gentle because they're in so much discomfort. So what we might do with someone in that situation is try to get some, we know that movement of joints can be pain relieving. So we'd be focusing on getting things moving that are not aggravating usually where the disc is. So let's say Dr. Carla had a problem at her L4, L5 disc. Let's have you lie on your side facing me, and we'll just kind of show some of the things that we might do. So this is a person or patient in a sideline position. If her disc herniation was around here, L4, 5, I'm probably not going to be touching. I'm not going to be putting a big force in there. But just below that, down here, the sacroiliac joints, there's a lot of pain relieving potential in getting them moving, and also in the muscles here, the gluteals, the piriformis. If someone has a disc herniation pressing on nerves that become the sciatic nerve that runs down the back of the leg, then the last thing we want is to have pressure here and then more pressure due to tight glutes, tight piriformis muscles where that sciatic nerve is running through. So one thing we might do for some relief is some manual or trigger point work on those muscles. We might use fingers or even an elbow to the patient's tolerance to get some relaxation of those muscles, take some tension off the nerve here, and that could be really helpful for them. Another thing, again, with the sacroiliac joints would be to do an adjustment or immobilization. So the difference between adjustment and mobilization is that immobilization is a lower force, is slower, and it would basically involve some oscillating pressure through the joint that could be very relieving as we get movement into the spine in a safe way, and again, avoiding the area that's very acute, that probably has a ton of muscle spasm involved as well. So as a patient can tolerate more, then we'll be doing more of a regular style adjustment. And again, often it's not going to be where the disc problem is, but the areas that are not moving well above and below. So for instance, the sacroiliac joints, and that would look like this. So from a prevention standpoint, one of the things that is probably a good use of your time is learning how to lift properly. And we see even in people who go to the gym and do things like CrossFit, poor lifting form. So Dr. Carla, if you just even demonstrate like a basic squat movement. And so a couple of pointers here. If you're picking something up, we have a wide stance. We have, as she's picking up a book.
Pick up a book.
Yeah, so we see a wide stance here, dropping the hips down to the floor, keeping a somewhat of a curvature in the lower back. So come on back up, Dr. Carla. You're noticing that she's not like, show the bad way. Yeah, so hinging forward and bending forward here. She's letting her hips do the work the way you would in a squat. We're getting low
with the hips and then grabbing whatever object we need to and standing up and keeping that neutral spine the whole time.
And avoiding twisting and lifting, because those twisting forces through the spine can be damaging to discs as well.
Yes, it's a big factor there.